I was admitted with what turned out to be heart failure, totally dehydrated, and also had a urinary infection.
He was brought to our attention by our front door team, where we identify people that are living with frailty, that are coming in some kind of crisis, and we then proactively get involved.
We know that people with frailty, their reserves are not as good as certain other patient cohorts that might come into hospital. We know that they're going to end up staying in hospital longer, they're going to have worse outcomes, things like deliriums, greater risk of infection.
I went through a bad period of intensive not knowing who I was, dissociation of mind and body, and that was very frightening.
Fred's needs were more than just taking the fluid off from the heart failure. We decided that instead of going to coronary care unit, we decided we'd come to the frailty unit and then have those other parts of the members of the team input into your care, and I think that was really crucial.
Suddenly my dad was in this place where not only did they get such thorough assessment of his physical health, emotional health, but also they got him, the human in him, and that was just incredible.
He needed therapy inputs and the nutrition and the activities and the nursing aspect, understanding Fred's needs, and that's also where I asked Amy to become involved as our physician's associate and the frailty specialist, because I knew that Amy would be able to understand Fred and give him that continuity was really, really important.
I got to know him quite well. I knew that what was most important to him was getting back home and becoming more independent again and being able to get back out and about and doing things.
And then eventually under Merlin's and Amy's help, was discharged from hospital.
Amy links up with our community medical teams.
People like community matrons, district nurses, his GP, the community therapy team. There's been lots of different services that have been part of Fred's care. So for Fred, I think that's been great because he's not had to kind of tell his story lots and lots of times to different people, or for other people to try and figure out what's been going on with him and kind of reinvent the wheel, as it were.
And that further feeds into one of our proactive frailty services, which is what we call our community frailty MDT.
So within the PCNs, within the different areas in Surrey Downs, and that's where district nurses, community matrons, volunteers, it could be anybody really that comes across somebody in the community that they might feel needs a bit more input. They can then present them within the MDT and we can pick patients up that way.
Which includes, your medications, your advanced care planning, your chronic health conditions, your mental health, your social care needs. We've been able to see benefits, I think, just to the individuals, but we've seen it on a system level as well, with a very marked reduction in emergency department attendances for that cohort of patient that have had that proactive care.
There are so many different teams involved, but all those teams play a part in the jigsaw, in maintaining and increasing my dad's health, independence, mobility and well-being. And that has been, it's almost like there's been this incredible orchestra around my dad and the conductors. Particularly, obviously, Amy and Marlon have been the most incredible conductors in making sure everything is well coordinated and sings.
Now when I come to see him, I have to be quick and out of the door because he's got lunch plans with friends in the pub. So it's just been incredible to see his journey, and I'm just really glad that the service could help support him and keep him at home and give him his independence back.
Amazing care. You can see it. I'm getting emotional now because it's just phenomenal.